Today we're going to talk about hip hinging some more. So one of the important things that we need to make sure is nice and mobile when we're learning how to hip hinge is the entire pelvis and the pelvic outlet, the coccyx or tailbone, and sacrum. In order to really let your femurs hinge in the joint, there actually needs to be some widening happening at the pelvis as well. So if the pelvis is being wedged together because of muscle tightnesses, ligaments that are tight, whether it's from injury or emotional stress, any trauma to the organs inside the pelvis there, all the muscles of the pelvic floor and the fascia will be really tight and not allow for a lot of movement there. That means if the pelvis doesn't move, the movement is less likely to happen in the hips since it's part of the articulation of the hip joint, and that means movement is going to be more likely to happen in the lumbar spine. So, and that is really when the destructive forces happen in the lumbar spine, causing injuries. So one of the things that you can do is first just orient yourself to the pelvis and what it's all about, how the anatomy is. The better you can imagine the anatomy in your brain, in your eye, as the athlete or clinician, the more easier it is going to be to open things up. So first we're just going to talk about that. So I have my model here. Here's the femurs, cut off, and the pelvis. So when you're sitting on your pelvis, a lot of people don't realize, they think maybe you're sitting on your tailbone, but you're actually sitting on your sits bones or ischial tuberosities. So many times though when people sit, they tend to sort of roll back on the back side of their ischial tuberosities, which does put a lot of pressure on the tailbone here. As that happens, it takes the whole sacrum into a extension like that, putting the lumbar spine in relatively more flexion. Most of the time, people don't even realize this is happening. So as this is happening, you also see that you have diminished hip flexion. So if I can teach people how to sit a little bit more on the center of their sits bones, send their tailbone back, you see how it automatically restores the curve in their lumbar spine and creates more hip flexion. So if you're trying to improve someone's hip flexion, hip hinging in an RDL motion or a squat, it's really important to also pay attention to how they're sitting or what their sitting habits are, because most of the time they're sitting during the day, not working on their hip hinging. But at the same time, that's the whole point, is every moment they're sitting, they're actually have an opportunity to either improve their hip hinging function or make it more poor. So in order to find where you are on your sits bones in sitting, it helps to do a little soft tissue or stretching of the area. And that's what we're going to work on next.